one of the main causes of the opioid crisis generally is a lack of understanding about different types of pain, and a misappreciation, the fact that acute pain after surgery or trauma, that is appropriate pain signaling that tells us that something bad has happened and reflects tissue damage and responds really well to opioids, is mixed up with chronic pain. And chronic pain is pain that goes on for more than 3 months with no clear reason for that pain, no ongoing inflammation, no ongoing tissue damage. And that represents a dysfunctional pain system that doesn't respond to opioids and has very different factors in its initiation and has a very different treatment at its heart. And by pushing opioid use onto patients who have chronic pain has been the major problem in this crisis.
So the differences in pain management weren't fully understood, or they were ignored in the rush to prescribe these opioids. Is that it?
Yes, I think you're right. I think initially there was an underappreciation by the medical profession in the 1980s and 90s that the messages we were getting from acute pain patients, or indeed from patients having palliative care for end-of-life cancer pain, where again there's an ongoing tissue damage, there was a misappreciation really that those patients did very well with opioids, and that message was then transferred into the chronic pain community by doctors. And it also became mixed up with an idea that addiction wasn't possible if you had pain there. And that is just wrong. But still, Big Pharma carried on pushing these drugs to non-pain specialists, to family doctors who possibly didn't understand the difference between these two conditions.
What, in your view, can be done to end this crisis, this epidemic? It calls for more regulation. There are always calls for more regulation in situations like this. But do you think that's the way to go?
No, I don't think so. I think we need to make sure that opioids remain available to patients who will benefit from them most. And that's the patients who have had surgery or who have had trauma and have acute pain, or who have cancer pain at the end of life and need opioids that are very effective for palliative pain. And we particularly see in lower income and middle income countries, they have very little access to opioids for those patients who would benefit from them most.
Is the downside of this opioid epidemic around the world that doctors now are increasingly reluctant to prescribe opioids? And is that dangerous?
I think you're right. I think I would hate to think that we would be impacting patients with cancer at the end of life, where we know that opioids are very helpful and very important, and also patients having major surgery. We shouldn't be too scared to use opioids, but we need to make sure we use them wisely and support patients in using them well. And I think, unfortunately, those lower and middle income countries where they haven't got access to opioids are looking at what we've done in the States and Canada and the UK, Australia and Europe, and said, well, thank God we haven't been letting our patients get opioids, because look what a mess it can cause. And I think that's a huge pity.
Dr. Jane Quinlan, many thanks to you for joining us on The Agenda.
Thank you.